So good day everyone. I am Concepcion Ramos. I am the last reporter. So I will going to continue about the learner with difficulty with self-care. So I'm going to continue with their learning characteristics. So students who have difficulty with self-care oftentimes reach developmental milestones at a later age compared to typically developing peers. Due to cognitive difficulties, children with ID or intelligent difficulty may also have deficits in this area of reasoning, planning, judgment, and abstract thinking. Of course, those students who have difficulty with self-care, they can be what we call late bloomers compared to those typically developing peers. And due to cognitive difficulties, or what to say, difficulties, the way they think, children with intelligent difficulties may also have deficits or may also have a loss in this area. Reasoning, planning, judgment, and abstract thinking, they may be deficits in the psychological area, the way they think, because they already have intelligent deficits or difficulties. Youth with ID are known to be friendly, sociable, and are reported to have the positive coping skills. That's according to Carter et al. 2015. The study reported that the strength and positive traits of transition age youth with intellectual disability and or autism are following. So, those kids, those learners that known to have intelligent disability, known to be friendly. They are friendly, of course, as what you have observed in nowadays in the environment. If you saw somebody with intelligent disability, they are really friendly. They are really sociable, and they really have the positive coping skills. Yet they have their own. They may be late developers, they may have deficits in some areas, but that's not totally mean they are totally lost. Okay, again, youth with intellectual disability and or autism are the following. First, they have a positive outlook in life. So, when you say intelligent disability, if you saw youth with intelligent disability, look at them. They have positive outlook in life. They view future in a positive way, right? In a positive manner. Second, they show positive relations with others. Again, they are friendly, they are sociable. They show positive relationships to others. Have active coping skills, have accepting coping skills. If they have active coping skills, they also have accepting coping skills. They accept. Okay, now these results suggest that the importance of having to find strengths in us children with additional needs and use them to their advantages. Of course, lectures reflect it to us as a future teacher. No, we are not able to diagnose students, and we are not allowed to diagnose a student. So therefore, we have to find their strength, not to bring them down, but to use it as their advantages, as their strength in ways, right? Okay, that's all for the learning characteristics. Let's move forward to general education adaptations. Specific approaches have been found to be effective in teaching students with difficulty with self-care, namely the use of direct or explicit instruction, task analysis, forward and backward training as well as the use of video modeling. So let's dwell first with the task analysis. Now, what is task analysis? In general education, adaptations to the learners with difficulties with self-care. Task analysis is a behavior approach that breaks down complex behavior tasks into step-by-step procedure. So, task analysis, it is how teacher manage, or how teacher should break down complex tasks into step-by-step procedure so students can directly understand. You're not just merely giving them the instructions directly, but you explicit it. You take down it into step-by-step manner. But it should be in a chronological order. Okay. According to Gargoglio 2012, provide working guidelines in how to task analysis. So Gargoglio provided guidelines on how to task analysis, how to break down tasks into step-by-step matters. First, define the target or task. Second, identify the required skills to complete the task. Third, identify necessary materials to complete the task. Next is observe an able and competent person to perform a task, of course. For example, tutor or someone to what we say. They will be the one doing it first, then the students are looking to them, right? Like that. They should be able to find that kind of person so that maka-help siya to the students. And lastly, a list needs steps in sequential order to complete the task. Okay, for example, hand washing steps, It is example of task analysis. You are breaking down the procedure into steps like first, turn on water. Second, wash with wet hands. Third, scrub with soap. Fourth, rinse or clean. 5, dry hands. That's how you do task analysis according to Gargoglio 2012. Next is the forward chaining. The program begins with the first steps in the sequence, such as getting the toothbrush and toothpaste, then provide the needed handover and assistance, and then gradually fading verbal and then gestural prompts. The goal is to allow the students to master the first step and then followed by the next step in the sequential until the entire task is performed. So, the program begins, forward chaining. The program begins with get your toothpaste or get your toothbrush or get your soap and get the water. So, and then kanang provide them the need or hand overhead assistance. After that, you are going to fade slowly the verbal and then gestural prompt. So therefore, the students may master, they may become independent and master the first step. Okay, first step. First step, turn on the water. Okay. Then second, with your hand, like that. So, therefore, the students at the end, they will know what to do after that, or what to do next time. Alright. Let's move forward to backwards chaining. If kanina, we talked about forward chaining, now we're going to talk about backward chaining. The teacher models all the steps from the beginning and then allows the child to do last step of the behavior chain with assistance and prompts. For example, when teaching a child to wash their hands, the teacher may turn on the faucets, apply soap, and guide the washing. The child only does the last step, such as drying their hands. Later, the learns the steps before that, and so on. And after after that, the teacher doing those, the learners will this means that they allowed to complete the task themselves. Now they feel satisfied because they complete the task themselves by doing the last steps. And after that, the child learn the last steps. They slowly practice more steps, going backward until they can do a whole task independently. That's the backward chaining. Now, lastly, we will have the video-based interventions for students with difficulty with self-care, including video and video prompting for teaching daily life skills such as brushing teeth, sitting at table, etc. had been found effective for learners with intellectual and learning disabilities. So, for instance, in students with intelligence disabilities, no, if they have that, so video prompting there plays a vital role because those are, for example, students with autism. They don't like lessons that makes them boring. They don't like lessons that they can't really get engaged, right? And they don't like lessons that they're just merely talking to them. They want to engage, no? They want to get joyful. They want to get motivated in the class. So showing them the video-based intervention or the video model, like for example, teaching daily life skills such as brushing teeth. When you show them a video brushing teeth in a what we call funny manner na lang siguro, what we call engaging manner, no? The manner that the students are able to learn because they are engaged. Because then after that, showing them a video of washing hands, like then singing the steps or singing the process. Students with special needs really wanted to have that. And students with intelligence disabilities or students with autism or ADHD or whatever, they want that, okay? Because they wanted to get engaged. They wanted to feel that they are able to learn, okay? And it is easy for them to learn. That's according to Rainier 2011, Bellini and Accordion 2017. But when you show them the video teaching the how to wash hands, learners with intellectual and learning difficulty found it effective. Okay, it's effective for them. Kasi nga, naiinganyo sila na makinig at tumingin. Kaya natuto sila. And those with disability, hindi sila, and maybe they are late bloomers, but if they catch up, madali na lang nilang gawin iyon. That's how they work, and that's how students with disability learn. Maybe late blooms, but still one day they will learn and they will master it. And in that some cases, sila yung matagal makakalimot. Okay. And thank you everyone. That's all for my discussion. And thank you everyone. That's all for my discussion. Hopefully you have learned something. Again, this is Concepcion Ramos. Thank you.